I'll be using this stethoscope and this lighting to do my exam today. Hi, my name is Mackenzie. I'm going to be your nurse today. What's your name and date of birth?
OIM 9/7/1995.
Nice to meet you, Noah. I'm going to be doing a cardiac exam on you. Is that all right?
Yep.
Okay. First, we're going to start by assessing your carotids. Can I have you turn your head? I'm just going to shine a little light here. I'm checking for any visual pulsation that is visible to the eye. I don't see anything, which is normal. And I'm also going to check at your maximum pulsation there below the nipple, and I don't see any pulsing, which is normal. So I'm going to go ahead and assess your carotids. I'm going to do these one at a time. 2+. 2+ pulses, that's good. Now I'm going to do your angle oblique. The angle oblique is where your mandible reaches your sternum, and then I'm going to assess for each of the valves where I will listen to your heart sounds, okay? So where the mandible reaches your sternum, right there, and then we're going to walk ourselves to the right, and we're going to feel for the aortic area at the second intercostal space, palpating for any pulsation, which it's okay not to feel. So now we're going over to the left, staying at the second intercostal space, where will be your pulmonic area. Again, feeling for that impulse or pulsation, which is okay not to feel. Walk our way down to the fourth intercostal space, which will be your tricuspid area. Feeling for a pulsation impulse. And then where we're going to feel it is in the mitral area, which is going to walk a little bit farther down, midway below the nipple, below the breast. In the fourth and fifth intercostal space will be your mitral area, where we should be able to feel a pulsation, which I do feel about 1+. So now I'm going to take the bell and diaphragm of my stethoscope and listen to each heart sound. Okay? First, I'll start with my diaphragm, listening to each heart sound. And now I'm switching to the bell. I do hear those S1 and S2 sounds. No extra sounds are heard, like S3, S4, murmurs, clicks, or rubs. Now I'm going to listen to your carotids, but this time I'm going to have you hold your breath for each one, and I'm going to listen with the bell. So go ahead and hold your breath for me. Okay. I'm just listening for that thrill. You can hear as a normal thing. Alrighty. Now I'm going to have you turn to the left. This is just another way for me able to hear any extra sounds. I'm going to listen at that mitral area below the nipple. No extra sounds heard, as well as I'm going to also feel again to feel a better pulsation, which I do feel better when at 2+. And then I'm going to have you sit up, sitting in a sitting position. I'm just going to have you lean forward a little bit as I also listen again for any abnormal sounds. and I don't hear any abnormal sounds. Your rate with your heart was regular, normal, and regular rhythm. And I'll have you lay down again. We're going to move on to assessing, you can sit up a little bit more comfortable, assessing your arms. So I can see that your arms show no swelling, they're symmetric in size, not one's bigger than the other. Your veins are not prominent, which is also normal. Color is pink. In color, no signs of blue or anything. I'm going to check your cap refill. I'm just pressing on your nail beds, noting the return, how fast the return and color comes back. Again, doing it on each nail. And I know less than 3 seconds in your cap refill is less than 3 seconds. Now I'm going to do radial pulses. Two plus pulses. Now I'm gonna feel for your brachial pulses. Brachial. 2 plus. 2 plus. And now I'm going to look at your epitrochlear nodules and feel and palpate for those, noting any, looking for any swelling. No swelling. No swelling. Now I'm going to move down to your legs and uncross them for me. I'm looking at them. I notice that your hair is distributed equally throughout onto your feet and toes. Your legs are pink in color, evenly colored all the way to your feet and toes. I see no scars, lesions, rashes, ulcers. I'm gonna feel for warmth using the back of my hands. The temperature is warm, evenly warm throughout. I'm gonna check for capillary fill on your toes, just as I did on your hands. Pressing on the nail beds. Looking for a quick response. Less than 3 seconds. Now I'm going to look at your Doralis pedis pulses on top of your foot here. Two plus pulses. Now your posterior tibial. Two plus pulses. Checking for some pitting edema. Top of your foot here and over to your medial myolysis, just kind of in the back. No pitting edema on your shins. No pitting edema. I'm gonna check for your popliteal pulses. One plus. 1 plus. Now I'm going to come up to your femoral artery and I'm going to palpate for your femoral artery. One plus. Now I'm going to palpate for your inguinal nodes, which is right by your femoral artery. Noting no swelling. Now I'm going to do an Allen's test on you. I'm going to have you close your hands. Okay. I'm going to hold both arteries of your ulnar and your radial. And I'm going to have you quickly open your hand and I'll let go of one. ready, go. Noting the color coming back, and we're gonna do that again. Letting go of the other one, let go. Noting a quick return in color. Now we're gonna do the other hand, closed fist. Okay, again, quickly open. Noting a quick turn in color. And again, quick turn in color. Last test that we're gonna do is I'm gonna lift your legs up. We're looking for any venous insufficiency. I'm gonna lift your legs up, waiting for kind of a paler color throughout here. And then when we're done, I'm gonna have you sit here and dangle your feet so we can see the color return, okay? Okay, I'm gonna have you sit quickly and dangle your feet. Noting 2-second quick return in color to your legs and feet. Then I'm gonna have you stand as I'm checking for any varicosities on your legs. As I see no noticeable varicosities, which is good. I believe this completes our exam. Thank you.